gonna get started. Thanks everyone for attending. So my name is Michele Schultz and I'm one of the physical therapists at React Physical Therapy's Lakeshore East location, which is located right off of the loop, or in the loop off of Columbus and Randolph, right behind the Blue Cross Blue Shield building. Missy Ludi is our clinic director, and she's gonna be helping to flag me down for any questions that you guys may have during the webinar if I don't see them in the chat along the way. Just a little background about React. We are a boutique style outpatient physical therapy clinic with 6 clinics around the city in northern suburbs. And at React, we focus on a whole body approach and stress one-on-one care. At specifically our Lakeshore East location, we have providers with an array of specialties ranging from women's health, so both internal and external work, and vestibular therapy. We are offering telehealth services as well as in-clinic services at this time. So if you're interested or know of someone in need of skilled PT services, we can usually get you in very quickly. And in Illinois, we have direct access, meaning that you do not need a doctor's script for PT services prior to coming into the clinic for an evaluation. We also are offering complimentary screens for any injuries that you may have. And again, before we get started, if you have any questions throughout the presentation, feel free to place them in the chat. Don't be afraid to ask a question throughout the presentation. Missy will chime in throughout, or I'll stop and pause throughout, but I wanna make this as interactive as possible. And if anyone misses anything, you can also rewatch this video as the recording of the slides and the video will be available on the website for you afterwards. So I am gonna start sharing my screen with you for the PowerPoint. Oops, okay. All right, so I'm super excited to talk to you guys about how to manage hip flexor tightness and overuse with the use of active releases, stretches, and a functional warm-up. So some hip flexor anatomy. The hip flexors are a group of muscles located on the upper thighs near your hips, which include the psoas here, the iliacus here, and the rectus femoris, which is located down here. The psoas originates at the lumbar spine, which you can see here, and spans through the pelvis to insert onto the greater trochanter of the femur, which is your thigh bone. The iliacus, so this muscle here, originates at the iliac crest and then goes into the same spot on the femur where the psoas inserts, or that same place on the thigh bone. And the psoas and the iliacus actually share a fascial sleeve when it crosses the inguinal ligament, which is essentially your hip bone right here. Once it passes this point, these two muscle fibers share a fascial sleeve to insert as the same muscle, or the iliopsoas muscle, on that thigh bone. And the rectus femoris stems from the ASIS, which is here. So if you were to find it on yourself, it's that like bone that kind of sticks out on the side and then spans your entire thigh and inserts at the knee. So I'm gonna show you guys a video that kind of shows how the muscles work. So these 3 muscles are responsible for important movements, like bringing your knee towards your chest and allowing you to bend forward at the waist. These muscles can become shortened or tight from overuse or injury, but the most common contributor is sitting for extended periods of time. So a tight psoas pulls the lumbar spine forward, leading to an excessive curve in your low back or causing a lordosis, and creates an anterior pelvic tilt, which you can see with these arrows in the picture. which increases stress on those lumbar vertebrae. This postural issue is a common cause of low back pain and stiffness. And in addition, this altered posture inhibits or turns off the opposing muscle group, which is the glutes, leading to muscle imbalances. And often microspasms and trigger points develop in these overused or tight muscles, like the hip flexors. All right, so some common symptoms associated with hip flexor tightness include low back pain and or stiffness, pain in the lumbosacral region, particularly when sitting or changing positions arising from sitting to standing, difficulty or pain when trying to stand in a fully upright posture, pain in the buttocks, groin and or pelvic pain or soreness, contributing to knots in the muscles surrounding those areas, and limping or shuffling strides when walking or running. So low back pain and soreness in the groin area may be signs that you're weak in the abs and overusing your hip flexors. Another clue is not being able to keep your feet and legs down when you do a sit-up. So here's the problem. When you exercise, is everyone back? Sorry, I don't know what happened.
Yep, we're back.
Okay, when did it cut off?
Sit up slide.
Okay, the sit-up slide. All right, let me share my screen again. So sorry about that, you guys. Okay, I'll start that slide over. Okay, so pretty much what I was saying is the problem is that the low back pain and soreness that you tend to feel is usually due to weakness in the abs and overusing those hip flexors. So not being able to keep your legs down when you're performing a sit-up. So when you exercise to target the abs, you perform exercises that decrease the distance between your thigh and your trunk. So as the hip flexors are a strong group of muscles, they try to take over. So you end up working your hip flexors more than your abdominals. And when your abs aren't strong enough to do their up and over contraction, so for when the trunk and thigh get closer together, the hip flexors tend to take over and the feet fly up. The reverse of hip flexion is hip extension, which occurs when the angle between your thigh and the front of your pelvis increases. So a good example of this is when you move your leg to the back behind you. Our glute muscles and hamstrings are the primary muscles of hip extension. So it's important for the muscles of hip flexion and hip extension to work together in a balanced way. And many times when people have tight hip flexors, they have weak hip extensors. So strengthening the glutes and hamstrings and never going too heavy when you're exercising can help relax those hip flexors. But before you strengthen, how do you get out of your hip flexors? So this isn't always simple. A lot of people have to constantly work at not engaging their hip flexors. So for one thing, you can't really leave the hip flexors entirely out of most ab exercises. They're still an important part of the picture. The idea is to get in the habit of involving the abs as much as you can to keep the hip flexors from taking over. So focusing on your form and making minor adjustments to your body position can help your hip flexors relax during ab exercises. And the hip flexors are already one of the tightest parts of plenty of people's bodies, mainly because of sitting all day. So starting your core workouts with already tight hip flexors can make it even more challenging to keep them quiet during those exercises. So when your hip flexors are already tight and you do lots of core exercises that have you feeling your hip flexors even more, you're just causing them to become even tighter. So I'm going to get into some demonstrations of some active releases, stretches, and a functional warm-up. And again, with spending more time at home and performing home workouts, or if you're just starting to get into a regular exercise routine, as gyms slowly begin to reopen, it's important to incorporate simple movements into your everyday schedule and routine to decrease the risk of injury while trying to stay active. So personally, I have found that performing specific exercises as a warm-up to be extremely helpful in elevating my performance during my workouts. And the ones that I will be demonstrating will help to create a balance between flexibility, mobility, and strength, particularly for injury prevention. So I'm gonna.
We had a question.
Oh yeah.
Which was the question is that if you are keeping good posture but still sitting for long periods of time, will that still lead to shortness of the hip flexors?
It will, because they're gonna be in that position. However, you just may not have pain. So yes, the shortness of the hip flexors is inevitable in that situation, but you may just not have symptoms. And that may be due to possibly a core contraction that you have when you're sitting throughout the day. A lot of time that's not the case, but that may be the case of why you may not have that tightness in your hip flexors. But most of the time, most people do. So I'm gonna show you some of these things that you can do to help decrease some of the tension in those hip flexors. Does that answer your question?
Yes, it does.
Okay, cool. All right. So let me angle my screen. So I'm gonna start by doing a hip flexor release using the lacrosse ball. All right. So in order to find the hip flexor, you're gonna find your belly button, and you're gonna find that ASIS, or that hip bone that I talked about in the beginning, where that rectus femoris, so the quadricep muscle, stems from. And you're gonna find the place right in between there to place the ball. If you palpate it yourself, you'll probably feel a little bit of increased tension through that area. So I'm gonna show you on the ground how to release the hip flexor once you find that tight and tender spot. So placing the ball at that spot, this way. I'm gonna slowly increase my body weight onto that area. Now, if you feel like this is pretty tender, you can off-weight that area by putting more weight onto the other side, so taking some of the weight off the ball itself. But if you feel like you can tolerate the pressure, then slowly increase that pressure by putting more body weight or rolling your hips a little bit more onto the side that you're targeting. I'm gonna bend my leg up and then rotate it side to side. So I like doing active movements through my releases when I use a lacrosse ball or foam roller. Number one, you're working those fibers that are already tight, so that ball of fibers causing that knot. But also, you can think about it as a reciprocal inhibition. Like I said, if those hip flexors are overly tight, the glutes and hamstrings are usually not working, or those deep rotator muscles. So doing this motion actively actually helps turn on those deep rotator muscles and helps turn off the hip flexor. I usually like to recommend about 10 to 20 repetitions in each spot, but listen to your body too. If you feel like you can use a little bit more in that spot, consider a little bit longer. But this is how I like to perform an active release of the psoas specifically. Like I said, there's the quadricep, which is one of the other muscles of hip flexion, particularly the rectus femoris. So I like to use a foam roller to get into that, just because that muscle tends to span a larger area of the body. You can get in a little bit broader with the foam roller to cover that larger muscle group. So laying on your stomach onto your forearms here, I like to start by going just below the hips, where the rectus femoris originates from. And I like going proximally to distal, so starting at the top and working my way down the line. And again, because if most of your tightness is in the hip itself, you're probably going to be tighter up here than you are at where it inserts at the knee. So placing the foam roller at that spot. Again, the same way that I explained it with the psoas, you can decrease the amount of weight put through the foam roller by placing a little bit extra weight onto the other side if you feel like it's too much. Or if you feel like you can tolerate it, you can put even more pressure onto the foam roller itself. So also just like the sodas, I like to do an active movement through this release. So knee flexion and extension. Same thing for reciprocal inhibition. So turning off the rectus femoris by activating those hamstrings. And again, same thing. I like to do about 10 to 20 reps in each spot, but again, listen to your body. Once you feel like you release that one spot, you can roll down to a different part of the muscle and perform the same motion. If you feel like this is too much pressure on your arms, you can also do this on your side. So now so before I was targeting more so of my right side, but if I'm turning towards you, just so you can see me on camera, I'm targeting my left side now, and then I can do it this way. If it hurts to hold yourself up in a plank position.
Hey, Michele.
Yeah.
Could you speak just a little bit slower and a little bit louder? It's just a little echoey in the clinic.
For sure. Yes, I will. I apologize about that. Okay, so here I am targeting the other quadricep muscle. Trying to take a little bit of weight out of my forearms here. If you have pain or if it's hard for you to hold this position. And again, spinning that entire thigh. So like I mentioned earlier too, if you are overworking your hip flexors, so your psoas and your quadricep, that means you're underutilizing your gluteal muscles. So usually I also like to perform a glute release when I have tight hip flexors. And I'm going to show you how to do that using the lacrosse ball. So finding the glute muscle. So there's probably a few spots that will be tender on you if you have tight hip flexors, if you have underutilized.
Hey, Michele, we lost you again.
Sorry, you guys. Can everyone hear and see me again?
Yep.
Okay. Sorry about that. I don't know why it keeps going in and out. Okay. So I'm going to start from the glute release. I'm pretty sure that's when I went out. Okay. So finding my sit bone and going just to the side of that. If you palpate it yourself, you'll probably find a tender spot. We're going to place the ball in that position and sit right on top of it. Same thing, I'm going to perform the motion here through that knotted area, essentially to help get the fibers that are kind of wound up in a ball to get into a straight position so that the muscle can activate more appropriately through an exercise, or just in general to activate so it takes some of that pressure out of the hip flexor. Now there's another position that you can also perform this in. So again, like I said, you have your glute med, which is a little bit to the side, and then you also have a glute max, which spans the entire buttock area. But because it's such a large muscle, there's probably trigger points in a different position than that side glute area. So what you can do is find that spot, which is usually right below the pelvis, placing the ball at that spot, and to get a little bit more pressure into that spot, as opposed to the side glute muscle, laying on your back will help to get more perpendicular onto that glute max. And I'm going to perform that same motion of going in and out. Again, about 10 to 20 reps in each spot, but listen to your body as well. So now that I have worked out those knotted areas, essentially, I want to be able to keep the length in that muscle. So now I'm going to perform some stretches to keep the length in that muscle so that we see more lasting changes in that hip flexor tightness. And I'll like check the chat really quick and see if anyone has any other questions.
Michele, you're doing good. We had a couple of little specifics, but I just answered them.
Oh, perfect. Okay, great. Thank you. Okay, so now I'm going to get into some stretches. So, the first one that I'm going to show you is a hip flexor stretch. So there's two ways you can do it. I'm going to show you one laying on your back and then one that you can do in kneeling. So laying on your back. So this specifically, I'm stretching out my left hip flexor. So I like to keep the opposite knee bent up because it helps to take out some of the extra curvature in the lumbar spine here and help decrease some of that low back pain that people may experience throughout this stretch. So this is a little short for me, but usually what I recommend is doing it on a surface where the leg can fully drop outside the table without hitting the ground, using the force of gravity to help get a increased stretch throughout the front of the thigh here. However, you can also make the stretch a little bit more intense by bending the knee. So this actually increases the stretch through the rectus femoris and also the entire hip flexor muscle complex. This one is more based on getting the psoas itself, where you add the knee flexion in because the rectus femoris, so that quadricep muscle, spans the hip and the knee. Adding this knee flexed position or bending of the knee will help increase the stretch through the psoas and the rectus femoris. You can hold it here, but if you don't have the flexibility, you can use a strap and place it around the foot and then just hold it around the shoulder here to increase the stretch through the psoas as well as the front of the thigh into that rectus femoris in this position. I usually recommend holding the stretch about 2 times for 30 seconds on each side. But again, like I said before, through the releases, just listen to your body and see what it needs. Okay. The other way that you can do this stretch is in kneeling. So one knee forward and one knee back. And then shooting the hips forward, you'll feel that hip flexor stretch through the front of the thigh on the leg that's in the back. One of the things I like to recommend when going into this stretch is kind of how I talked about, if the hip flexor is overly tight, the glute muscles turn off. So by using the cue or thinking about using your glute to drive your hips forward, you'll help to turn on that glutes. So activate that glute while stretching the front of the thigh here. You can hold this position for 2 times to 30 seconds. And then same thing how I talked about, you can get more into the rectus femoris. So that third hip flexor that I talked about, you can bend the knee up here and also hold it this way. Now this may be a little bit too much pressure on the knee if you're putting it straight onto the ground. But if you feel like you like this position, you're getting a deeper stretch more so than when you're lying flat on your back, just put a cushion or a pillow underneath the knee that's down on the ground on this side to make it a little bit more comfortable for you. Again, holding for 2 times for 30 seconds. I also like to do a little bit of mobilization sometimes through the movement as well. And I like to increase that by using an exercise band that I can place around the hip. So essentially the band is going to be added to increase the space between the pelvis and the thigh bone essentially. A lot of the times when the hip flexor is tight, there tends to be an impingement in the hip here. So I'm going to show you how to decrease that impingement by using a band. So this is a rogue band as opposed to just like a TheraBand that you usually get like from a physical therapy clinic. I like this band more so than a TheraBand because it's a little bit thicker and it's more broad, so it doesn't feel as uncomfortable when placing it in the crease in between your pelvis essentially and your thigh bone. But if you don't have a rope band, you can still use a TheraBand. I just recommend placing a towel in between the band and your thigh to make it more comfortable for you. So placing the band here, through immobilization itself, I like to use active movement. So like I talked about, when squeezing the glute or squeezing the tush to drive your head forward, you can do the same with that rope band. And again, with this mobilization, I like to come in and out of the movement as opposed to a stretch holding it. And if you want to change up the angles too, like you feel like there's like a certain part that's pinching a little bit more, just change up the angle in your thigh, change up the angle that the band is at to help specifically get that specific spot. Again, you can do about 10 to 20 reps in this spot, or listen just to what your body needs at the time. I can check the box and see if there's any questions before I get into the functional warm-up exercises.
Michele, one of the questions that we had was just on modification of glute release. If the intensity of the ball when you're laying on it is too much, what might you suggest?
So like I said, doing it in sitting may be a little bit less intense than doing it while lying on your back. But even if you feel like in sitting it's too much, kind of what I talked about with the hip flexor, if you feel like there's too much pressure into the ball, just off weight your weight onto the other side, so on the other glute, to take some of the pressure off the ball on that side, and still work through that movement. A good indication that you're putting a good amount of pressure through the ball as well is if you're able to move your leg through the motion. That's usually a pretty good indication. A little discomfort is fine, but I don't want any sharp pain. And also make sure too, the lacrosse balls are usually pretty dense, so staying off of bone will be pretty key when using this, and making sure that you're only on soft tissue. You'll know the differences of the very increased discomfort that you'll have if you put on the ball. Does that answer your question?
Yes, it does. And I had also suggested perhaps that you could do it against the wall, just like you demonstrated,
yeah,
to moderate the pressure.
Totally. Just decreasing the amount of weight that you're putting through the ball. And you can change it up with different positions. Correct. Okay, cool. All right, so now I'm gonna go into a functional warm-up. So what I usually like to say about a functional warm-up in general is I want it to mimic the movements that I'm gonna do in my specific workout. So warming up the body in that specific way and activating muscles in a certain way to help them activate even better when I'm trying to strengthen them during my workouts. So,
oh no, you're muted again.
hi everyone, so sorry for the third time.
You're back.
I'm back. I don't know what our interconnection here must be bad. I have not had an issue like this before, so I really apologize. Okay, so I'm gonna get into that functional warm up. Like I said, I'm gonna start with good mornings, okay? So, with good mornings, change my angle up a little bit. So, like I said through the presentation, if your hip flexors are overused, your glutes and your hamstrings are usually underutilized. So I want to try to activate them before I work them out. So essentially I don't want to strain the muscle when I'm working it out if I'm not able to place it in a position to properly work during my workout. So I'm going to put my hands behind my head just to get myself in a good upright postural position. Keeping a nice flat spine, sticking my glutes or my booty back as I go down in a flat back position. slight bend in the knees. Now I tend to have some pretty tight hamstrings, so this bend in the knee is probably a little bit too excessive. But the idea is to keep a nice upright, flat back position, feeling a stretch through the hamstring, and then as I come up to the top, squeezing the tush. This is activating those glutes and hamstrings for the workout. Placing the weight into the heels of my feet as well helps to also activate the back side of my legs instead of the front side of my leg that is overworked with tight hip flexors. All right, so that is good mornings. Now, another warm-up that I like to do for the core specifically is a plank, just a regular high plank. There's a couple variations that you can do through it though to help activate some different muscle groups. So I'm gonna angle my screen down a little bit. Okay. So getting into high plank, first I'll talk about kind of getting into a good position for a high plank and how you know. So I like to do this in front of a mirror so I can see the positioning of my body. But I like to make sure that you have a nice flat back here. A lot of the times people tend to fall into their low back, and this is not a flat spine. This is actually probably going to cause some of that low back pain that's typically associated with hip flexor tightness. So to help find a good position, you can start on your hands and knees, go all the way down and all the way up into your cat-cow, and then finding that neutral spine in between. Now, if you feel like you're still having a hard time trying to see if you have that flat back, the other thing I like to cue is tucking the tailbone down. This tends to be somewhat of a confusing cue though, because if people tuck their tailbone, sometimes they start curving in their upper back. But I want to make sure that you keep a nice flat back. So here, if I'm tucking my tailbone out, so this is too much of a curve in my low back, just try to straighten out that low back without moving the upper back here. So once I find that neutral spine position, get into high plank. A couple of things that you can do to help warm up is I like to do some plank walkouts. I'll kind of explain the muscle groups that I'm targeting along the way. So right here, holding high plank, I'm activating my core. I'm gonna walk my hands back towards my feet. This is gonna get now a nice hamstring stretch. And then I like to stand up at the top and squeeze my tush. So I'm activating my glutes at the top by squeezing them together. I'm stretching my hamstrings when reaching down towards my toes, and then helping to activate my core in the high plank position. So one more time, holding my nice high plank, that nice flat spine here, walking my hands back. Getting a nice stretch through the hamstring, and then squeezing at the top of my tush to help activate those. Through these functional warm-up exercises, I tend to be bad at counting, especially if I'm listening to music. So I usually set an alarm on my phone or a timer and usually do each functional warm-up for about 30 to 45 seconds. Again, you can listen to your body if you want to do a minute or if you want to do less, that's totally fine. But usually I find about 45 seconds is a pretty good warm-up for each exercise for me. So another exercise that you can do to help activate that core and kind of incorporate both the hamstring and the glute is I like to do a high plank position, and now stepping with one leg towards the outside of my hand, and then placing that or bringing the hand that the foot just moved towards and rotating it up. So now I'm kind of getting a nice little stretch through the thoracic, so the mid back and the low back. It tends to get overly tight with the tight hip flexor. I'm stretching the hip flexor of the back leg, and by bringing this leg forward, placing most of the weight into the heel of the foot, I'm now activating my glute. So I'm activating my glute, I'm stretching my hip flexor, actually activating the hamstring in the back here by keeping the leg nice and straight, taking it out of my hip flexor, and getting a nice stretch through my thoracic spine. And I do usually alternating movements to do this on the other side. So bringing that leg forward, putting the weight to the heel to activate the glute, stretching the hip flexor of the back leg, as well as using the hamstring to keep this position to lengthen the leg. Rotating through my thoracic and lumbar spine, getting my stretch in this neck. And then, of course, holding the high plank position activates that core. All right. So those are 3 exercises that I like to incorporate before every workout. And there's 2 more that I'm going to talk about to help activate more so the glutes. And then one that you can do to help try to find that nice neutral spine position as well, if you feel like you have a hard time doing it through any of those plank variations that I just talked about. So bird dog is a good one that kind of helps ramp down the intensity of the high plank. But you're still getting core activation, glute activation, and essentially lengthening through the entire posterior chain. Like I said, that usually is over or underworked with having a tight anterior chain or front side of the body. So finding that neutral spine position that we talked about, you're gonna lift the opposite arm and the opposite leg. So I'm gonna lift this leg straight back towards the wall. The reason I like to say to reach it back towards the back wall as opposed to up is because typically when people lift the leg up towards the ceiling, you see that bend in the low back. So I'm reaching the leg back straight towards the wall. You're kind of decreasing the amount of curvature in the low back. So with the opposite leg here extended, I'm going to extend the opposite arm. Again, keeping that neutral spine position. When I have patients or clients do this exercise in the clinic, I usually tend to place a foam roller on the low back to help let them know that they're losing that neutral spine. So if you don't have a foam roller to put across your low back, you can put like a pencil or you can roll up a towel and place on your low back just to help you give a little bit of cueing as to if you're doing the exercise correctly or not and finding that neutral spine. So again, lifting the opposite arm, opposite leg, the legs going back straight towards the wall and reaching my arms straight forward towards the other wall. And I like to alternate this movement. Again, each one shall warm up for about 45 seconds. And then the last exercise that I'm going to show you guys is a glute bridge. Now there's quite a few glute activation exercises that you can perform, but I truly like the glute bridge, especially with a tight hip flexor, because I'm lengthening through the hip flexor when I do that, and then turning on both the hamstring and the glutes. So, laying on my back, I'm going to make sure my feet are hip width apart, with the feet facing forward. When I press my hips up towards the ceiling, most of the weight is going to be in the heel of my foot. The reason that the weight is in the heel of my foot is to turn on that hamstring in the back of the legs, and then being able to lengthen more so to the front of the thigh. If you put your weight through the front of the leg, you're going to feel, or through the ball of the foot, you're going to feel the front of the thigh activate. So I want to turn that off because it's already overworked. I want to turn on the back side of my legs. So putting the weight through my heel, I'm going to drive my tush up towards the ceiling, squeezing the butt cheeks up top, and then slowly lowering it back down. I tend to not like to
Oh no, we need a reset.
Hello, I'm so sorry again. This is the last exercise. I promise we are making it. I will repeat the glute bridges. Okay. So I think I got through how to explain the proper form of the glute bridge. But if you feel like, again, like that's not enough, or you want to make this more of a strengthening exercise, you can add an exercise band around your, just above your knees to help you a little bit increase glute activation. So I'm going to place the band just above the knees. Before I get started, I'm going to pull apart on the band slightly, bringing those knees in line with my feet, and just creating a little bit of tension. Already, when you pull apart on the band, you're activating those glutes, even before you start driving your hips up towards the ceiling. So this is just get a little bit more activation through that backside. So creating that tension, keeping that tension throughout the entire movement, driving my hips up towards the ceiling, and then again, keeping the tension on the band as I lower down. Again, I like to do this for about 45 seconds. Okay. That was all of the demonstrations of the active releases, the stretches, and the functional warm-up. So I'm just going to share my screen one more time with you guys, just for a summary slide and to give you my contact information. Okay. So, in summary, as you work on increasing your awareness of the relationship between the abs and the hip flexors, you'll discover there's reciprocity in terms of one set of muscles doing the stabilizing of the trunk and pelvis, while the other set moves them. What you want to achieve is a muscular balance, better functionality, and ultimately more choices about how you move. So compliance is important in order to see this improved muscular balance, in addition to improved performance, but most importantly, to help prevent injury. With regular performance, you can effectively address the weakness and deficits through the specific targeted exercises. And in PT, we address tightness in the hip flexors with many methods, which include soft tissue mobilizations, dry needling, stretching, and exercise prescription. So PT can be a great benefit for a more effective outcome. If you have any other questions, place them in the chat and I'll check it in 1 second. But I just wanted to show you guys my contact information. If you have any questions about anything about this presentation that you think of even after we stop the presentation, just feel free to email me at any time. I'll usually respond pretty quickly. And again, I'm at the React clinic at their Lakeshore East location, and I'm kind of dabbling around the West Loop location as well. So feel free to reach out with any questions at any time. I'm gonna just stop sharing my screen so I can see any of the lasting questions. Missy, was there anything that I missed?
The only thing that a couple of people had asked for was where to find the recording, which we directed them to bereact.com/event resources.
Perfect.
And we had a patient who asked if you could share the specific exercises and functional warm-up that you demonstrated via a PDF. So maybe if you had links or a list of them that we could provide, maybe at that same link.
All right. Yes, I will definitely add that. I'll have our event or like our event coordinator, Ashley Hoden. I'll have her upload the specific exercises and through a PDF for you guys for that. Anything else? I'm glad to help you guys out anytime. And again, yeah, please feel free to reach out via email if you have any lasting questions. again, very sorry about all of the in and outs of the video. Hopefully it uploads okay. Otherwise, I am doing the same presentation on Monday. If you have any questions about that, you could also sign up again online. But since you guys already have logged in, just feel free to email me as well. All right. Thanks for taking the time. Hope you guys have a great evening and a great rest of your week. Stay safe, healthy, and well, everyone. All right. Bye.